I'm Dr. Timothy Johnston. Let's talk for a quick moment about sensitive teeth. There are lots of reasons for sensitive teeth, and your dentist will be able to help diagnose what that might be. Anywhere from a cavity to a root canal problem. Certainly there's some legitimate causes for sensitive teeth. But one of the biggest causes that we see in practice today is actually the toothpaste that you're using or the beverages you're drinking. If you have a little bit of gum exposure, a root exposure from the gums pulling back, and it happens with age to most people, then the root that it's exposed is susceptible to sensitivity. What makes that worse though? Well, there's a natural little protein layer laying in that root surface that keeps most of us happy and healthy, but many people, that little protein layer washes out from acids. One of the most notable acids would be sweet drinks, soft drinks, colas, things with acid. Even diet sodas, the ones that don't have any sugar, still have acid component to it. Or if you're a fan of acidic drinks like grapefruit juice, or sports drinks like Gatorade or Powerade, those sports drinks are usually a lemon lime concoction that's very acidic. You could also get it even from drinking red wine, that's acidic as well. So try to limit those, that would help. But here's the bigger one, ready? Your toothpaste. Up until about the early 1990s, no toothpaste was around that said tartar control or whitening. And then after the advent of tartar control toothpaste, suddenly about 25% of the people that come in my door were having sensitivities in their teeth, including myself. I called my rep, the one that sells the brand of toothpaste that we use and suggest in our office, and I said, "Hey Nancy, what's going on?" And she said, "Well, we recognize that maybe as much as 2% of the population is going to be having a little bit of increased sensitivity due to the tartar control ingredients. Those ingredients are a little bit harsher, they're a little bit more caustic, they tend to be a little more acidic, and they tend to wash out that little protein layer." Well, that 2% in real life turned out to be more like 20 or even 25%. And again, this is based on my own observations in my practice. We currently have over 8,000 patients that see us at our practice, and I can tell you that's a legitimate number. So what's my solution? Go back to basics. If you look in the grocery store shelf, you're going to find all the high-priced tartar control and whitening toothpaste right at eye level. And then all of the original toothpaste like Colgate or Crest, original paste that's been around since before I was a kid, those are on the bottom shelf. And they're often a lot less expensive, maybe half the price of some of the fancy ones. As long as I personally use one bottom shelf toothpaste, Crest or Colgate, my teeth are fine. As soon as I put in a tartar control or a whitening paste, or really anything that says total or complete or has the hoop-de-goo extra stuff in it, you're going to find some sensitivity. I know that's the case for me and a lot of my patients. So if you're having sensitivity, and there's no real good clinical reason, like there's not actually damage to your tooth, try switching toothpaste. The other toothpaste that many people try is Sensodyne, and Sensodyne works very well, by the way. The active ingredient in Sensodyne is called potassium nitrate, and any toothpaste that says sensitivity toothpaste has potassium nitrate in it. Well, that potassium nitrate has a great way of sort of blocking up some of the chemical receptors of the nerve cells down inside the tooth. The problem with all of them is there's a documented rebound effect. So after about 6 months of using a sensitivity toothpaste, the body actually becomes more sensitive again. That's the rebound effect. So while the potassium nitrate or Sensodyne toothpaste are great to use them for a while, not forever. What I tell my patients is to use them a tube at a time. So use a tube of Sensodyne. When that runs out, use a tube of Crest or Colgate. Bottom shelf, no added ingredients into it. When that runs out, back to the Sensodyne. Those are for the people that really do have a real struggle with the sensitivity. And you'll find that works very well as well. Thanks for watching, and I hope that helps with any normal sensitivity issues you're having.